Hello, Professor Meek. Chairman Xavier Wallace here. So my video exemplar is for type 2 diabetes, and I'm going to start with the pathophysiology. And for this, we know that a type 2 diabetes is a lifelong disease, and it keeps your body from making enough insulin. That is, makes your body insulin resistant. And this is usually occurs for middle-aged and older population, and this is why it's called adult onset diabetes. That's a popular name for it. This kind of diabetes also affects younger teens, but those are mostly because if they had childhood obesity, they are more predisposed to it. There are about 29 million people in US with type 2 diabetes, and 84 is predisposed or already pre-diabetic. And this of course means that their blood glucose is high, but not high enough to be called diabetes yet. So for our medical diagnosis here, this list I'm about to mention, it's not like a conclusive diagnosis. Well, you would need a blood test and other kinds of tests to make it conclusive. But this includes the symptoms, includes increased thirst, frequent urination. We see extreme hunger, unexplained weight loss, and blurred vision. And also when you have sores, it takes longer time to heal, and also frequent infections. Now for our assessment, my patient again today is Mr. Wallace. I'm going to take his history down, his genetics, maybe if his family, his family is predisposed to diabetes. It runs in his family, so I'll take that into history. His exercise habits, his social habits like drinking or smoking, and also work habits as well. I'm also going to assess your glucose level and sugar level today, Mr. Wallace, and I'm also going to be carrying out some tests like AIC level tests, and we keep checking these every few times in a year. So for our lab diagnostics, we are looking at a few major lab testing that would make it conclusive if Mr. Wallace has diabetes type 2. These, the most important ones include a glycated hemoglobin test called AIC. This indicates blood sugar level for the past 2 to 3 months. This will check the level of glucose in his blood in your blood the past 2-3 months. And the normal level we're looking at is 5.7%, and anything above 6.4% is considered to be a little bit pre-diabetic. You are in that zone of being diagnosed with diabetes. Now anything above 6.4, 6.5 and above, then we conclude that you have diabetes. Now another test we can carry out is random blood test, and this one is we'll have your blood sample level, sugar level. If it shows 200 milligrams, including the symptoms of diabetics, we can say that is a little bit in the range of normal. And anything above that level with some symptoms like frequent urination and extreme thirst, we would conclude that you either have diabetes or you're predisposed to it. Now we also have fasting blood sugar test. This is taken after an overnight fasting, and the reading for this is anything 100 mg is or less is considered normal. Anything above 125 is considered pre-diabetics, and after 126 you're considered to be diabetic with this fasting blood sugar test. We also have other tests which includes oral glucose tolerance tests. Is also not commonly used except for pregnant women. And we also have hemoglobin A1C, we have serum total protein tests, we also have ADH tests, immunoassay, insulin tests, and microalbumin and creatine testing. Now, for potential or actual complications during treatment, we can see anything ranging from you having heart and blood vessel disease, stroke, high blood pressure, and narrowing of your blood vessels. Also, complications can include kidney, or complications and actual damages can include kidney damage, diabetes and drug treatment, and also we can see irreversible kidney damages as well due to the drugs or the side effects of prolonged diabetes. We can also we may also see some eye damage where your the tiny blood vessels in your retina has been narrowed and is thinning out. That could cause some eye damage. We can also expect to see maybe some hearing impairment, and of course your skin, like we can see now, you have some blisters that would take longer time to heal. Those are actual complications from your diabetes untreated. Also, you may have some sleep apnea, and in worst case scenarios, some you might develop Alzheimer's later in the year. Now, reduction of this risk, how to reduce this risk that I just mentioned to you. This would include trying to get you to have some weight loss. This would help you keep your blood sugar and glucose level low. We also try to help you to eat healthier. This will help you track down the carbs and the sugar intake in your daily nutritional intake. Also, exercises and physical activities will help your heart rate up. This reduces your blood level and strengthens your muscles as well. And watching your blood sugar levels periodically will help you get ahead of it. Now, for nursing intervention, this means what I will do for you, Mr. Wallace. This includes, I'm going to, for your duration of your treatment here, I'm going to constantly check your vital signs. This will include your blood pressure, your pulse rate, and your blood sugar and glucose level. I'm also going to be monitoring that, and of course I'll perform some blood glucose tests, and I'm going to make sure I recognize if you have hypoglycemia or hyperglycemia, and I'll be able to administer glucose or reduce glucose per the healthcare provider prescription or order. I'll also help in maintaining your glucose level and diet control while you are in treatment, and of course help you with your exercises, range of motion, ambulating, and also your daily activities while you're staying here. I'm also going to help you achieve your weight loss goal, and also identify interventions to prevent risk of infections or relapsing, and as well as I'm going to help you quit smoking or help see a way we can reduce your smoking, which will help the treatment go faster. I'm also going to help Mr. Wallace and educate him, his family, or his health supporter about type 2 diabetes, the side effects, medications, symptoms, and prolonged care. I'm also going to make sure you have emotional support, and if you need a psychological evaluation, I will recommend a therapist, and as well as include a dietitian. Now, medications for type 2 diabetes, this includes I'll mention the ones that have side effects. That way I will go through the list. Now, metformin, an example is Riomet. This lowers your amount of glucose in the level in your liver and helps your body respond to insulin intake. Now, the side effect of this is you might have metal taste in your mouth, and you experience a lot of tiredness or dizziness, and some kidney complications might arise, as well as stomach aches. Now, for sulfonylureas, an example is Amaryl. This helps your body make more insulin and help you keep your glucose and sugar level low. Now, side effect of this drug is you might end up gaining some weight, and you might have skin rashes or itching all over. Another drug we're looking at is megalithionate. An example is Starlix. This works faster than both the other drug I mentioned before, like Amaryl. We also have sulfonylureas, and this is a side effect of this can be another thing like gaining weight and also lowering your blood sugar level. We also have alpha glucose inhibitors. These can cause bloating or gas, or you passing a lot of gas, and it can also cause diarrhea. These there are other medications we can administer. Those ones I can give you a list of that. And then we have patient teaching. Now, this is just to inform you that if you have any questions or you need anything from our medical team, you can always call and let us help you any way we can. This will be where I will ask him if he has any questions or any concerns, if he needs any extra thing to make him comfortable at this point, or needs to speak to someone else. This will be the point I will bring that up. So this concludes my video exemplar. Thank you so much. Have a nice day.